A court fight that could change the face of youth sports as we know it. Pop Warner, the nation's largest youth football league, has just settled its first ever concussion-related lawsuit. Yes, Pop Warner. This multi-million-dollar lawsuit was filed by the family of a 25-year-old who took his own life. His autopsy showed that he had brain disease from repeated hits to the head. His mother said those hits started at just 11 years old. So this morning, we're talking about what parents should know as they send their kids off to play any sport. We have Dr. Robert Melillo, the founder of the Brain Balance Center, and also Coach Bill Solomon, president of the Brooklyn Titans Youth Football Organization. Good morning to both of you.
Good morning.
Good morning.
And I want to start, Doctor, with you. And just, I think the stats on this are pretty clear and they're pretty disturbing. Between 1.6 and 3.8 million traumatic brain injuries in sports a year, and more than 50% go unreported. So I've got to ask you, as we look at this case, is this the tip of the iceberg?
I think it is, yes. I think you're going to see a lot of this. I mean, you know, these types of injuries can happen very quickly and in very young people. So there's probably even going to be cases of younger individuals that have these issues, because when you look at concussions, you know, there's this whole chemical cascade that happens, and it can happen really quickly. And, you know, it's hard to tell how that's going to happen, but it's not really the first concussion, it's subsequent concussions, and there's a whole chemical change that happens in the brain, and it can cause degeneration very, very rapidly.
Yeah, you hear a lot of talk about CTE, and again, it's not the first concussion, it's how you react to the first concussion that determines whether CTE happens or not. So let me ask you, as parents are watching, what should they know as they're watching their kids play sports if they see something? What should they look for?
It's a tough decision for parents. You know, I played football growing up. I played in college. And I had my boys, you know, and I encouraged them to play. And the more I learned about head injuries and the more I knew about it, it's a tough choice. I mean, it's a lot safer game now, all sports are, than it was. But it's a tough choice because most kids, you know, they're not going to make it to college. They're not going to go into the pros. So, you know, do you want to risk their brain injury? There's a lot of benefits of playing football, the things you learn. Sure. So it's a very difficult choice. I wouldn't want to be a parent right now with a young kid making this decision. But, you know, for me, you got to choose the kid's brain. That's as far as my opinion right now. That's what I would tell parents.
All right. Coach, I want to talk to you now because I know that you are having these conversations every day with parents as you get ready for your seasons. Parents that are concerned about, look, they want their kids to be okay down the line. So how do you reassure them?
A number of different ways. We make sure that all of our coaches are trained so that they're practicing properly. The way we practice now is a lot different from the way that, I mean, I played all the way through college.
Sure.
We practice a lot differently than the way we're practicing now.
I mean, we never used the word concussion when we were playing back in the day.
No, you got your bell rung and you went back in. So, you know, the way we address any potential problem is different. We pull a kid out now, where before, you know, you shake it off and you go back in. We tell the parents to become educated. We provide concussion information to our parents. We let them know. We make them informed. And as I say, the fact that the doctor and I are both having played all the way from the time we were both very young, all the way through college, and we're here, you know, communicating about this issue, you know, says something.
You know, everyone is talking about this issue, obviously in the pros, but now even in our children. And I think you touched on something that's so important. I know that you can speak to, that I can speak to, because we've had your kids on. Brooklyn Titans, you know, remember these guys last year? We have some video. They were trying to get to Florida to play in that big championship game here at Pick 7. We rallied behind this team, and we met all these young men that went out there. And I'll tell you, I mean, talk about what this game, yes, there are the negatives, yes, there are concerns, but what this game can do to shape young men.
I mean, there was a recent Harvard study. The number one influencer for happiness is relationships. And the kids who participate in this, which is the football is really probably the closest analog for life that you can find among any sports. You have the physical, you have the mental challenge, you have the teamwork aspect of things. And, you know, the kids, I've had kids literally from that team who were crying to their parents, oh, football's over, I'm not going to see so-and-so until, you know, for the next couple of months. It builds tremendous character. The benefits you get from the sport are tremendous.
Yeah, we don't want it to be all negative. So let's end on this. We want to make sure that as parents, you know what to look for, the signs to, again, get your kid out of the game, because it's the repeated concussions that cause the big issues. Headache or pressure in the head, loss of consciousness, nausea and vomiting, dizziness. You've got to be alert for your kids. The coaches, of course, have to be educated.
Absolutely.
The kids have to be educated to know that, look, it's not tough to just go back in. So there's education that has to go all the way around. And bottom line is yes, we want our kids to grow. We want them to become successful adults. Sports is a part of it, but we don't want them to be injured long term. Gentlemen, thanks so much for coming in and sharing your perspectives on all of this. For more information about CTE and concussions, go to our Pix11 app, click on the Morning News tab. Time now is 7:39.
All right, only 5